infection, or it can cause urinary blockage. So there are very different terminologies which have been used, like benign prostatic enlargement, what we call BPE, and there is another terminology what we use is bladder outlet obstruction, and there is another terminology what we use is lower urinary tract symptoms, which is either bothersome or non-bothersome. And the histological feature of enlarged prostate is described as benign prostatic hyperplasia. So when we say there is a prostate enlargement, this enlargement can cause obstruction to the flow of urine, or it may not cause obstruction initially when there is a very minimal enlargement. And all the patients who have enlarged prostate may not have urinary symptoms because there is no significant urinary obstruction. That's why they may not have initially any symptoms. Now, coming to lower urinary tract symptoms, there may be patients who are having enlarged prostate can present to us with both symptoms like obstructive symptoms or irritative, which is also known as storage symptoms. Irritative or storage symptoms means patient come to us with frequency of passing urine, urgency, there is an urge incontinence, they have to get up 3 to 4 times in night, what we call nocturia. And also obstructive symptoms like poor flow of urine, they have to strain to pass urine. When they go and stand, there is an hesitancy to pass urine. It takes few seconds to start urination. And after passing urination, they feel that they have not completely emptied the bladder and they feel some amount of urine is remaining. And over a period of time, if the symptoms worsens, their symptoms increases, and one fine day they may develop complete urinary obstruction, what we call urinary retention, acute urinary retention, where patient will have severe abdominal pain. He can't pass urine, especially if he has taken a lot of fluids. This happens early morning and they come to emergency with unable to pass urine. That time we need to treat urgently. We need to relieve their obstruction by passing an urinary catheter, and once urine is drained, then we further investigate to see what is the stage of enlargement of prostate. So enlargement of prostate, there may be other causes of these similar symptoms which can happen in men, like if there is a stricture. Stricture means where there is an urethra, there may be a narrowing in the urethral lumen which causes obstruction to the flow of urine. That also presents similar to enlargement of prostate. Similarly, there may be a bladder neck contracture due to previous infection or previous stone impaction or previous surgeries. There may be a stones in the bladder which come and obstruct the urinary passage and cause urinary problem and urinary obstruction. Urinary tract infection, those who have infection, they have severe pain while passing urine. They may have frequency, urgency, dysuria, what we call. Sometimes they may have blood in the urine. So, and similarly, if there is an interstitial cystitis, this is common in females. Nowadays, we are also coming across in men. This also mimics like enlargement of prostate, where patient will have severe painful micturition. They have to pass frequently. They can't control urine. They wet their pants. And similarly, if there is a neurogenic bladder, for example, if patient is having any history of stroke or multiple sclerosis or some neurological problems, the nerves which are coming to the bladder from the brain or from the spinal cord get affected and the bladder won't function properly. And because of that, they will have unable to pass urine. They have to go frequently. Their bladder won't empty properly. Similarly, there may be a simple infection in the prostate. Usually it happens in reproductive age group, in young men who are sexually active, and once there is an infection in the prostate, they have frequency, urgency. They have to pass urine with painful micturition. Sometimes they get fever, chills because of infection. Similarly, if some people, they come to us with similar symptoms of difficulty in passing urine or with urinary retention, and sometimes they may be taking some medications which can cause this problem, like cough syrup, some anticholinergic, some medications which we give for asthma. All these are sedatives. Sometimes they can relax the bladder, they may cause urinary retention. Similarly, there may be a cancer in the prostate, which is very important to know. Any cancer in the prostate also, the presentation may be similar to patients who are having enlargement of prostate due to benign. So how to differentiate whether there is a cancer in the prostate or not? One, what we do is a digital rectal examination, and another we do a serum PSA test, which is a blood test, what is known as prostate specific antigen test. When we do this test, if PSA is high, and when we do digital rectal examination, if the finding is hard prostate, a nodular prostate, then we suspect there is a cancer of prostate and we treat accordingly. Similarly, if there is a cancer in the bladder, some people, they come to us with blood in the urine, with frequency of passing urine. There may be obstruction to flow because of bladder cancer. So now these are the two diagrams which tell us where is the prostate. This is the bladder from where urine gets collected, which comes from the kidney. And once the bladder is full, the sphincter opens and urine starts flowing when we try to pass urine. This is the prostate, which is like a walnut shape, which they have two lobes, right lobe and left lobe, which are present at the bladder mouth, what we call bladder outlet. And when it enlarges, it gradually starts compressing the urinary pipe. So when it compresses the urinary pipe, all the symptoms starts developing, like poor flow, frequency, urgency. And because of enlargement of prostate, when there is obstruction to the flow of urine, urine starts remaining. They feel that they can't pass urine completely. Because of urinary retention, they develop urinary infection. And some people, if there is a severe infection or severe retention of urine, they may start having ulcers in the bladder and they start bleeding in the urine, what we call hematuria. So now there is another important thing we should know, that there are receptors in the bladder as well as in the prostate, what we call them as alpha receptors. They are the nerve endings and they have a receptors where they are very important, because nowadays for enlargement of prostate, we need to understand there are receptors, and because of this presence of receptors, we can treat these patients with medications, which I will explain in next slides. So what is important is normal prostate, when we have patients may not, does not have any symptoms. Over a period of time, this prostate gland gradually enlarges. Usually it happens after 50 years over a period, and all the symptoms starts developing. And there are nerves which are coming from the brain to the spinal cord to the bladder. That's why I'm telling, whenever there is a any other associated neurological problems, either there is a patient having stroke or having a neurological problem or a spinal cord problem, they also will have weak bladder and they also present with similar symptoms. Now, what is the prevalence? As I told, this is the prevalence around 25% in the age group of 40 to 50 years. And as the age advances, at the age of 70 to 79, 80% of people will have this enlarged prostate. So such a high prevalence, that's why this is the commonest urological problem we are discussing today. And in India, the average prevalence is around 6.7 to 14%, which was reported in hospital and community studies. So how this pathophysiology happens? Once the prostate enlarges, what we call hyperplasia, gradually it starts blocking the bladder outlet, and that what we call bladder outlet obstruction. So And along with that, because of age factor, because of neurological disease, and as such, there may be a primary bladder disease where the bladder muscle, what we call detrusor muscle, may be either overactive or it may be underactive, which leads to urinary problems. So how this happens, a lot of patients come to us and ask why we develop this enlargement of prostate. This is an aging factor. Similar to you get white hairs as you get old. Similarly, you get spectacles as you become old. Similarly, as we age, there will be some changes in the prostate, what we call stromal cell proliferation and epithelial cell proliferation. That means the cells which are there in the prostate and the stroma which is there in the prostate starts enlarging, and that gradually increases the volume of the prostate. Normal volume of prostate is around 10 to 15 cc. So any prostate which goes beyond 20 to 25 cc we call enlargement. We have seen in our clinical practice the prostate is enlarged till 300 cc's. Initially, around grade 1 we call, grade 2 enlargement, grade 3 enlargement, and grade 4 enlargement. As the prostate increases in size, the symptoms increases, the problem increases, patient finds more difficulty in passing urine, and one fine day he will develop complete urinary blockage. So there is some guidelines for us to treat, how to treat the patients who come to us with this enlargement of prostate. Whenever patient come to us, first we take a thorough medical history, whether patient is having diabetes, whether how many months he is having this problem, whether we will assess the severity of symptoms, because it is very important to know the severity of symptoms to treat further. So severity may be mild, moderate, severe. There is a score known as IPSS score, which gives us an important idea how severe is the symptoms, how severe is the problem. So once we examine, we do a digital rectal examination, which tells us how big is the prostate, whether prostate is soft, hard. If it is hard, we suspect there may be a cancer in the prostate. And if there is a infection in the prostate, when we touch the prostate, patient will have pain, what we call tender prostate. Similarly, to rule out is there any infection, we do urine analysis, we do a urine routine as well as culture if we suspect infection. We do a serum PSA test. This is a blood test, what we call prostate specific antigen test. If the normal range is somewhere between 0 to 4, if it is high, then we suspect there may be a cancer. Sometimes it may be high due to infection, due to benign enlarged prostate. If it is very high, if we feel there is a hard nodular prostate, then we recommend to undergo biopsy for that prostate enlargement. So we tell the patient to undergo transrectal ultrasound guided biopsy, which is a simple test which we do in a OPD. And also we ask the patient to keep a frequency volume chart. This gives us how much urine he is passing, how frequently he is passing, whether he is passing completely at night time, or how many times he is getting up to pass urine. And further, we do some tests like uroflowmetry test, also known as flow test. There is an electronic commode which we ask the patient to pass urine in a full bladder. That will give us a graph and tell us how severe the obstruction is due to enlargement of prostate. And also we check by ultrasound how big is the prostate, how much there is a residual urine in the bladder. So this is the test which I am telling, a simple test which we do when we come across the patients who are having urinary obstruction, who are having prostate enlargement. We pass a rectum, through the rectum, we pass a finger and we examine the prostate. We feel the consistency, whether it is soft or hard, and then decide whether to do biopsy or not. And also we do a neurological examination to rule out there is, as I already told, patients who are having neurological problems can also present with similar symptoms. So we need to rule out there is no neurological problems. So as I told, uroflowmetry is a simple test, a non-invasive test, which we do patients who come to us with suspected enlarged prostate to know the severity of symptom. It gives us how much time he is taking to pass urine, how much urine he has voided after passing urine, whether he has completely passed urine. So it gives us a graph. So this is a normal flow graph, a bell-shaped graph, which gives us normally a person we should finish his urine by 15 to 20 seconds, and he should void at least 300 ml of a good amount of volume of urine. And this graph tells us there is no obstruction. And you can see another graph here, which is telling that it is like a flat curve. So here he is taking a long time. He is taking almost 50 seconds to pass urine. The maximum flow rate is reduced. It is around 8 ml per second. Usually it should be around, flow max will be around more than 25 ml. So this gives us a rough idea how severe is the symptom, how severe is the obstruction to the flow of urine. And this helps us to guide in treatment. So this is a flow chart. Once we initially do an evaluation by history, digital rectal examination, urine analysis, and prostate-specific antigen, we do an objective symptom assessment, what we call, we give a questionnaire which has a IPSS score and tell the patient what all the symptoms you have taken, whether you have frequency, urgency, sense of incomplete voiding, hesitancy, any you feel sense of incomplete voiding, all these. Then based on the score, we will come to know whether he has a mild symptom or a severe, moderate to severe symptom. If he is having a very mild symptom, we just ask them to modify their diet and fluid intake, reduce fluid intake at night if he has to get up frequently in the night, what we call watchful waiting. And if he is having a severe, moderate to severe symptom, we offer them either a medical therapy or a minimally invasive therapies or a surgery. So that is the thing. Sometimes, as I told, if we do an additional diagnostic test like flow rate test, residual urine, and pressure flow test, if all these tests suggest that there is a significant compatible with obstruction, then we need to treat them. If there are patients who straight away come to us with refractory retention, that means completely their urine is blocked. They come to us in emergencies, like completely urine is completely blocked. We need to pass a catheter, drain the bladder, and then we evaluate. Or patients who are coming with recurrent urinary infection. We evaluate why he is getting recurrent infection. Infection happens because when there is a residual urine in the bladder, when the bladder is not emptying properly, because of remaining urine in the bladder, they get urinary infection, especially if they are diabetics. And if they have gross enlargement of prostate, because of enlarged prostate, it starts bleeding at one point of time. Patient will come with bleeding in urine. They may develop retention because of bleeding and clots in the bladder, or they may develop stones in the bladder because of urinary retention. So enlarged prostate can cause stones in the bladder, which is a late stage or an advanced stage. Or if they neglect the symptoms over a period of time because of back pressure, because of urine remaining in the bladder, there will be back pressure on the kidney, and because of that, they develop renal insufficiency or kidney failure. So all type of patients we see in our day-to-day practice, and depending on what stage they are coming, we offer them the treatment. So what are the goals of therapy? As I told, once any treatment we do, it should improve his symptom. He should get better. His bothersome symptom should improve. His quality of life should improve. The prostate size should reduce, or we need to arrest the further growth. His peak flow rate, his passing of urine should improve. Obstruction should get relieved, and we should prevent long-term outcomes or complications, and it should be acceptable adverse. Any procedure or any treatment we give, there may be sometimes adverse effects. We need to balance and treat accordingly. So as I was already talking, watchful waiting is when we offer the patients who have a very mild symptoms, we just ask them to modify their lifestyle modification. We educate where is the prostate, how it is enlarged, what is the problem it can cause, or how to manage it, what are the future consequences which can happen if you neglect the treatment. So we educate each patient about where is the prostate, what are the problems. We reassure them if there is a very mild symptom. And we, as I told, lifestyle modification, there are people, there is a myth that as age advances, they keep on drinking more and more water. Those who are enlarged prostate, our recommendation is not to drink more water. The more you drink, the more urine will be formed, the more you frequently, already there is an obstruction, so you'll be burdening the bladder. So we ask them to reduce fluid intake, especially in the evening, because once fluid intake in the evening comes down, they get up in the night less. So that is how we do lifestyle modification. If they are obese, we ask them to reduce weight, because that also reduces, improves the symptom. And if all these measures fails, then we offer them the medical treatment. So there are once again a guidelines for us to treat which medications to use. We have a alpha blocker which is alpha adrenergic antagonist. We have 5-alpha reductase inhibitors, and we have antimuscarinics. So our recommendation is, when there is a bothersome symptom, as I told, if the symptoms are moderate to severe, then we start medication. We start alpha blocker. We have medications like alphazocin, tamsulosin, doxazocin, tazocin, silodosin. So these are the different medications which we use to treat enlargement of prostate, what we call benign prostatic hyperplasia. And all these drugs do have some side effects, like patient may develop dizziness, ejaculatory dysfunction, retrograde ejaculation, nose stuffiness. So we warn them, if patient develops symptoms or side effects, we ask them to come back and report to us, and we titrate the dose. Usually we start with smaller dose. If they are tolerating, we can increase the dose. If they don't tolerate, we put them on least medication. Sometimes patient may not tolerate, and we need to offer them other alternative treatments in the form of invasive therapies. So there is another drug known as 5-alpha reductase inhibitors. What we have is finasteride and dutasteride. These are the two drugs which helps in regression of prostate size over a period of 3 to 6 months. So along with patients who have enlarged prostate, they may have, along with this overactive bladder, that means they have urgency, they have urge incontinence. That means by the time they reach washroom, they will pass few drops of urine, or they have to rush to the toilet to prevent incontinence, and they go frequently. They will have that sudden urge to pass urine. If these symptoms are along with other symptoms, we should add antimuscarinic drugs, which helps in relaxing the bladder. We have tolterodine, we have sulfasenacin, which I will talk later. So there are recommendations to use antimuscarinic drugs in patients who are having prostate enlargement with overactive bladder. If already there is a lot of residual urine in the bladder, if it is more than 250 ml, then we should be very cautious, or we should not use give antimuscarinic drugs which relaxes the bladder. So there are side effects of these drugs also, like dry mouth, constipation. They may have nasopharyngitis, nasal stuffiness, dizziness. So we always explain the patients when we give any medication, what are the side effects and what they should come and report to us. So if they know in advance, all of our patients, they come back to us and tell whether they had side effects or not. If they are not having side effects, we ask them to continue the medications, because not all the patients will have side effects when we give medication. Roughly around 10 to 15% of patients come back and tell us there is a side effects. So with the combination therapy, there is a dramatic shift in the treatment of prostate enlargement. So now the recommendation for patients who have prostate enlarged, which have more than 40 cc or 35 cc, and they have severe symptoms, we give a combination therapy of both alpha blocker and 5-alpha reductase inhibitor. So there are so many evidences to give this medication, and most of the studies have favored that combination drug when we use that will relieve the symptom or that will improve the symptom. The advantage is relative risk of acute urinary retention will be reduced by 68%. So in future, developing urinary retention will get reduced. So definitely there is an advantage of giving medications for patients who require. So that is the another study which has told that a combination drug of tamsulosin plus dutasteroids helps in treating benign prostatic hyperplasia, and also it reduces the risk of BPH related symptom progression and also acute urinary retention, and that is why we use the medication. So there is another study, European Association of Urology journal, which has been published, and that also gives the similar picture that definitely it reduces the BPH and benefits the patient. So there is another study with silodosin and dutasteride combination, which has concluded that it is safe to use this medication in enlargement of prostate, and it will benefit the patient. So similarly, when there is an overactive bladder along with enlargement of prostate, there is a recommendation to use alpha-1 blockers with muscarinic receptor antagonist. If we use this combination drug, patient will definitely benefit and his symptoms will improve. So there is another study which also recommends of giving alpha-1 blockers with anti-muscarinic, which reduces, as I told, the urgency, frequency, nocturia compared to placebo, and definitely it will benefit the patient. So now there is another novel drug, beta-3 agonist, which is a new drug, mirabegron, which is more effective in treating overactive bladder along with enlargement of prostate, because relatively the side effects are less, because these drugs which we use are in old age. So when we use in aged persons, these drugs are relatively safe. So when we, a lot of patients come and ask to us whether there is a sexual dysfunction along with enlargement of prostate. Yes, definitely as age advances, the sexual dysfunction occurs. What do you mean by sexual dysfunction? Either patient may have erectile dysfunction, or he may have altered ejaculation, like he may have a few drops of ejaculation, or sometimes when we use these drugs, it may cause retrograde ejaculation, and as such, enlargement of prostate itself can cause sexual dysfunction with increase with age. And it is important to keep in our mind that patients who come to us with enlargement of prostate, always we ask about his sexual history, his sexual function, if he is having any erectile dysfunction. If such things are there, then we can treat both the problems simultaneously so that his quality of life, his sexual function improves. So in such cases, we use Tadalafil, which is also helpful in treating benign prostatic hyperplasia. Sometimes we use a combination drug of alpha blocker and Tadalafil to improve both his prostate symptoms as well as his erection symptoms. So with this, definitely patient will have better erections, and also simultaneously his urinary symptoms also improves. So as I told, not medication will work for all the patients. There are definitive indications for surgical treatment. The patients who are not responding to medication, if you give medication, not all the patients will respond to medication. Some patient may come back to us telling there is no improvement, or there is a very mild improvement, and they are not happy with the medicine. So those who are not improving with medication, or those who are getting recurrent urinary infection because of enlargement of prostate due to residual urine, definitely we recommend them surgical treatment. If they have developing blood in the urine, hematuria, because of enlargement of prostate, we recommend to undergo surgical treatment. If there is a retention, complete retention, is unable to pass urine, then medication won't work. In such patients, we recommend surgical treatment. If patient develops stones in the bladder causing recurrent urinary obstruction, then also we recommend simultaneously we can remove the stone and the prostate by using surgical treatment. So there are different varieties of surgical treatment. what we are using now is the transurethral resection of prostate, considered to be the gold standard. Now there are new treatments which have come and which are more effective and safe as TURP. What I am using is a holmium laser enucleation of prostate. Here we use a holmium laser. We pass this laser through our cystoscope. Cystoscope is a telescope where we pass through the urinary passage under anesthesia, under either spinal or general anesthesia, where patient won't find any pain. Then we enucleate both the lobes by using holmium laser. Holmium laser, the advantage is it completely removes the prostate. The laser has got an advantage of it enucleates the prostate completely. Bleeding is minimal or very less. Patient recovery is fast. Usually we send the patient in a day or two, and the results are excellent, because once we remove the enlarged prostate, the flow rate will improve, his sexual function will improve, his flow will go easily. All his symptoms which are having frequency, urgency, obstruction will improve. Nocturia will improve, where he has to get up in the night. There won't be any residual urine, and all the patients do well. So those who does not respond to medication, the best and treatment we offer is the surgical, which is safe, effective, and especially by laser, holmium laser, it is safer in old age. Those patients who are already on blood thinners, who are having heart problems, who are asthmatics, who are diabetics, who are having urinary infection, who are having tendency for bleeding, who are having coagulation problem. So we can use holmium laser enucleation of prostate, what is known as HOLEP, which is more effective, less bleeding, and patient will recover faster, less catheterization. There are other treatment like transurethral microwave therapy, transurethral microwave heat therapy, high intensity focused ultrasound, transurethral electroevaporation of prostate, photoelective vaporization of prostate. Some are still in experimental stage, some are still in yet to come to India. There are some other like ethanol injection, ultrasound, high frequency, water induced therapies. So there are variety of options, but commonly used procedures are either TURP or HOLEP all over the world. And now there are other therapies which are coming up, which are, we don't know the long-term data. And some patients who are not fit for these type of surgeries, we can use prostatic stents and treat them accordingly. So friends, at the end, take home message is the enlargement of prostate is seen in aging population. Since our India, the life expectancy is increasing, we are getting a lot of patients, old age people coming to us with this problem. So nothing to worry about this. Once there is a problem, always there is a solution for it. So patients who are having these problems should consult an urologist and get evaluated properly and treat accordingly. And similarly, not all the males who are having these symptoms may not have enlarged prostate. As I told, there are other causes of problems which can cause similar symptoms like stricture urethra, stones in the bladder, infection in the prostate, bladder cancer, all these neurological problems. So urologist is one who can exactly identify what is the reason for your symptoms, what are for your problems, and treat accordingly. Similarly, all enlarged prostate does not cause symptoms. Similarly, all enlarged prostate does not require surgery. Similarly, all enlarged prostate does not require medication. So initially, we can treat them by lifestyle modification, fluid therapy modification, and there are medications, there are combination therapy. If all this does not serve the purpose, then there is definitely a laser treatment for the enlargement of prostate, which is minimally invasive, safe. And at the end, what is our aim of this treating these patients is we need to improve their quality of life. As I told, this passage of urine, one should enjoy, one should freely pass the urine without any difficulty. because it is a social embarrassment to have these urinary problems, because when you go to function or go outside, if you want to go frequently, if you can't control the urine, or if you are unable to pass urine, then you will face problem. So those who are having these problems, my recommendation is to consult a urologist, evaluate properly, and treatment. Because if there is a treatment for this problem, and if you treat, the quality of life improves, your symptoms will disappear or improve, and you will get a good quality of life. So by saying this, I am very happy to talk about this common urological problem. I hope that it will benefit lot of people who are suffering from this problem, and I feel the message will go to the public. So we need to increase the awareness of this problem, because so many times a patient come in end stage, or they come in late stage, or they don't know whom to approach, or they suffer themselves. They don't even tell to their family members. Sometimes if they tell to the family members may also be not be knowing this problem. So increasing the awareness and getting treated on time is our aim. And also the ultimate aim is patient should feel happy at the end of the day when he get treated, and his quality of life should improve. So once again, I will thank all the listeners, and I request them to share all these my views to other people, so that public will get more awareness and they will get benefit out of this talk. Thank you very much. And once again, thanks all my audience and viewers to listen to me, and thank you very much. Yeah. So the person who have BPH, they have any chance to get neurotic, psychotic symptoms? It is a good question, a very important question. Yes. See, as I told, for our lifestyle to lead a normal life, our body should be in a fit and healthy. And as I told, these are the symptoms which disturbs your sleep, because a patient should not get up in the night, either maximum one time as the age advances. If he starts getting up every half an hour, 1 hour, 2 hours, it will disturb his sleeps. So when there is a lack of sleep, these patients become more angry. They will be more, anxiety will be more, they will be restless. Lack of sleep leads to depression or psychosis. So that is another aspect. If they have urgency, urge incontinence, they will be leaking urine. They have smell in their pants because of leak of urine. So it's a social embarrassment. They become introvert, they become depressed, and even the family members, they feel that what they think, they can't attend social functions, they can't go to the social gatherings. So definitely enlargement of prostate will have some neurotic psychotic problem. That's why identifying this problem and getting treated will benefit, and they can lead a normal life. So there is another few more questions I will go through. How to identify difference between BPH and prostate cancer if symptoms are safe? Correct. As I told, when there is a enlargement of prostate, 90% of the time it may be due to benign prostatic hyperplasia, which is a benign condition. 5 to 10% of the time there may be a cancer. So as a clinicians, when they come to us, we do a digital rectal examination and we feel the prostate consistency. Normal benign prostate will be like soft to firm. If there is a cancer, it looks very hard, it will be nodular, it will be uneven. And at the same time, we do a PSA test, and if it is also high, if PSA is high, if digital rectal examination is suspicious of cancer, then no doubt we do a ultrasound guided biopsy, and it will confirm us whether there is a cancer or not. Because if there is a cancer, this cancer also be treated very efficiently if it is detected early. That's why any patients who are having symptoms of enlargement of prostate, please do evaluate yourself and confirm there is no cancer. So there is So if there is any other questions, I have answered 2 questions, and I can see only 2 questions in the box. If any other questions, you can ask. Yeah. If symptoms are same, sometimes those who have enlarged prostate cancer, sometimes they may have backache, because if already the cancer has spread to the bones, because this prostate cancer is spreads to bones very frequently, and once it spread to bones, they develop pain in the bones, especially it goes to spinal cord and spinal bones and cause backache. And another difference is these patients will have severe symptoms if they have advanced prostate cancer, and they will have bleeding blood in the urine. And there is another question, doctor, if symptoms are severe, especially nighttime urination frequency, what to do? Yes, very important. Sometimes nighttime frequency will be very so much, every half an hour he is getting up to pass urine, his sleep is disturbed. So first we will confirm whether this is due to enlargement of prostate or any other reasons. As I told, it may be due to weakness of the bladder or also overactive bladder, especially if patients are diabetics, they have this night frequency more, because more urine is produced at the night. If they have uncontrolled diabetes, we need to treat it first. So control of diabetes reduces its frequency of urine. If they have neurological problems, then we need to identify and we refer to neurologist and get treated. By treating neurological problem, symptoms get better. If we rule out there are no other reasons, then it is only due to enlargement of prostate, and we found out if there is a more night frequency, then we treat by medications, and also we add antimuscarinic drugs where the bladder will get relaxed and you will have find more time to pass urine. That means its frequency will reduce. So that is how we differentiate, because there are so many reasons for night frequency or getting up night frequently. And sometimes those who are having cardiac problem, if they have heart failure, when they sleep, there is more urine production in the night compared to daytime. And these patients also come to us with frequent urination. If there is uncontrolled diabetes, if they have neurological problems, if they have infection, then also they will be getting up in the night. So we rule out all other reasons. If they are there, we treat accordingly. Then if it is due to enlargement of prostate, we treat accordingly. There is another question, is that urine control and urine leakage is part of BPH? Correct. See, what happens as a prostate enlarges initially, the bladder become overactive, it become irritable, and patient develop irritable urinary symptom like frequency, urgency, and suddenly he will develop urge incontinence. That means by the time he reach washroom, he will be passing few drops of urine. Sometimes other thing happen at extreme, over a period of time, because of enlargement of prostate, the urine starts accumulating in the bladder, and it gradually bladder gets expanded, and over a period of time it becomes overflow incontinence, what we call the bladder gets completely full and few drops of urine starts coming out. It's like a bowl which is full of water and little leaks. Similarly, little small amount of urine starts leaking, you will develop overflow incontinence. These patients come to us with lower abdomen distension because of bladder has become so much big, it has caused back pressure changes in the kidney, and they will be passing little urine without control, and they will be wearing diapers. And by catheterizing them, we will reduce the enlargement of bladder, and we identify, and if there is an enlarged prostate, we offer them treatment. So these are the questions which were there in the chat box. I hope I have answered all the questions. Yeah. Thank you very much. Yeah, we can close the meeting. Thank you very much. Thank you.